Hi everyone, think got real. We all know that coronavirus is so much rampant all around the world. We are in big trouble. Time has come where we need to address it very seriously. Though we expect this virus to behave like the previous generation of coronaviruses or like influenza or SARS, this behaves much differently. Things are much worse because of its pandemicity. The pandemicity is so rampant, the whole world is being shut down. Even if you get the disease, 80% of us will get only as mild symptomatic flu kind of a scenario and we get on with our life. But the problem is we infect somebody else. A want to meet C, in between infects B. What happens is this B can infect a D and B and D cannot be known unless they become sick, even though A and C can be identified and quarantined. That's a big problem what we have. 80% of the people will have some clinical symptoms or no symptoms and escape. 15% of the people will develop clinical symptoms which needs medical management, especially the elderly and smokers. These people will have to be quarantined and tested. But the problem in our country is we don't have enough kits. So we have to wait for a week before the clinical symptoms become worse and then we will end up doing the testing. However, these people might improve, but there are 5% of individuals who need intensive care therapy. And of course, most of them of that 5% needs ventilatory support as well. And that is when the trouble is. Our system is not equipped for this pandemicity. This is exactly what happened in China, Italy, and Iran. They reached the threshold within a week or 10 days time and they didn't know what to do. The country got shut down and the old people are led to die, pulled off a ventilator, which no healthcare person want to do. US and UK are fast approaching this stage. If you think we Indians are different, what can happen to us? Think again. We, with a kind of a infrastructure and a kind of a healthcare system what we have, do you think we can manage this kind of a pandemicity? No, we cannot. So what to do for that? Let me explain to you few of the precautions and the treatment protocols what has been postulated so far. Number one, flattening the curve. What do you mean by flattening the curve? The COVID 19 epidemiology that happened in China, Italy, and Iraq shows peaking in a short span of 1 to 2 months, whereas a country's threshold of healthcare, especially Indian threshold, it's too low. We cannot manage even half of such patients in our healthcare setup. So, to avoid this, the typical scenario of COVID has to be brought down. So, by social distancing and isolation, we bring this down so much so that our healthcare system can manage, even though the number of patients will be the same. That helps us to treat these patients well within the healthcare system. Self isolation is very much important for people who already have some flu or something, and they have to make sure that they are very, very careful with it. B. Safe hygiene. Very, very important. The first thing we should do is hand washing. Wash hands with soap, otherwise, hand sanitizer is a must. Should not touch your mouth, face, and nose so regularly. Wash them. Avoid contacts by handshaking and other things with another person. And of course, wearing a mask helps in a big time because most of this spread through nose and mouth. Wearing a mask will not protect you from getting the disease, but it can protect you from spreading it, as mouth and hands are the commonest way of spread. Singapore, Hong Kong really helped by making everybody wear a mask. These things can help you to really flatten the curve well. A two in our remedy is prophylaxis. That's how to beat the disease other than flatten the curve. There are plenty of non-medical remedies that has been postulated for SARS virus, previous influenza viruses, and specific to respiratory viruses. These can be followed for COVID-19 viral diseases as well. First and foremost, stay fit and lung healthy. Yoga, pranayama can really help us. Though they have a lot of benefits, they improve lung capacity, they improve lung health very well, and they even help in asthma. So in that case, pranayama will be a good incentive to start with. Do some kind of a routine exercise that improves your stamina, increases your cardio by increases your heartbeat, that helps the lungs to be much better.
Try to make sure you do some free exercises of running or stretching, or it can be some kind of a platform exercises which helps a lot of core, or using props which can give stamina as well as core. Diaphragmatic breathing has to improve, which helps to fight against pneumonia by giving good resistance, which is pretty much the important reason why COVID 19 patients fall sick.
If you don't want to do exercises, there are simple ways like incentive spirometry, a machine that you will blow in or suck air in and move the balls up and down. That can help you to improve your lung capacity. That gives the same result as a pranayama or fitness routine gives. Try to stay fit and healthy. Second, the important stuff what we I'm going to discuss is very interesting, called hot air inhalation.
Respiratory viruses grow in cooler parts like nose and sinuses, and they die at high temperature of more than 130 degree Fahrenheit. There are plenty of evidence to prove that this can be used in a normal life to safeguard ourselves. We talk about sauna, where it uses hot air at temperature of 140 degrees. You use it for 20 minutes twice within an hour daily during an outbreak. You might reduce the amount of coronavirus in the nasal system, and may not be evidence based, but it's worth trying. Dr. Dan Lee Dimke also addressed something called as cold arrest. We don't have a sauna, then you can use hot air from the dryer of the hair dryer along with sterile water spray at high mode into the nostril and deep breathing for 5 minutes. Doing it for 2 to 5 times daily can help, but there is little evidence to prove its effects. But the same principle is used as a treatment of COVID 19 therapy in China by the CPAM, which issued guidelines in February. They used nebulization with 5 million units of sterile water and warm hot air, made the patient to be breathing it along with other treatments, which is a part of the protocol of treatment of COVID 19. So, no harm in trying these when you have no side effects. So we may not know, we might get helped with reducing the severity of the disease or reducing the number of days of the disease as well.
Now the most important part of the COVID-19 update, treatment. Since there is no clear-cut guidelines on what is the kind of treatment that cures the disease, there is some roadmap on how to reduce the symptoms and decrease the severity of the disease. It has been tried in China, tried in the US and the Europe, and now we possibly can help our country with this treatment to start with. We use plenty of drugs for our flu kind of a scenario. Let us not do them. Use only paracetamol. Apart from paracetamol, no point in taking any antibiotics or any other additive medicines. There is a big debate about the use of ibuprofen. Initially, it's been banned since it's been seen to have correlation with the severity of the disease and death in old people. Then they found that there's not much of a severity. Still, it is recommended not to use ibuprofen much. Then the use of steroids. Steroids were used in plenty of studies since the SARS days, but found to have no added benefits. Next comes a very interesting concept of using antiretroviral drugs. The two possible drugs that are commonly used, lopinavir 400 mg, ritonavir 100 mg. Lopinavir and ritonavir comes as a combination drug as well. Use this combination twice a day for 2 weeks, but only when you are diagnosed with COVID-19. Otherwise, paracetamol is good enough. A third side of things. Since the last 1 week, there's been an interesting addition of hydroxychloroquine. Hydroxychloroquine is postulated in two ways. One, as a prophylactic treatment. Two, as a treatment along with the retrovirus for COVID-19 positive patients. If you wanted to avoid COVID-19, hydroxychloroquine can be used as a prophylaxis, which means to prevent from the disease. 400 mg once a day for a week is been postulated by US government. Using hydroxychloroquine along with antiviral drugs and nebulization with hot air, sterile water helps in reducing the number of days of illness very well by 2 to 3 days, and the severity has been reduced as well in getting into a severe pneumonia. So in that case, hydroxychloroquine has to be used as 400 mg twice a day for the first 2 to 3 days, and then once a day beyond that for the next 4 to 5 days. Mind, don't use chloroquine. Chloroquine can cause toxicity. Use hydroxychloroquine alone. However, we all know it's only early stage of the treatment protocols. Things may change with the new antiviral drugs being tested as well. Desperate times calls for desperate measures. Let us all be safe, being inside the house, quarantine ourselves if we are having much of a problem with flu. This is the update as of now. But guys, let me give you a secret. We in India, because of our weather, because of our herd immunity, we might escape. Be safe. Until I come with the next update, this is Raj signing off.